Okay, we're going to get started. I hope everyone had a great holiday and you're off into your new year well and hitting the ground running. I am going to do a brief roll call to see who's present from the committee. So bear with us. Angela Gamboa.
Here.
Thank you. Harley Fleech. Dr. Fowles. See that you're on. Elizabeth Paz.
Here.
Thank you. Jasmine Snipes.
Here.
Thank you. Carrie Steving. Kathy Busby.
Here.
You. Monica Curry. Dr. Wilson.
Happy New Year.
Happy New Year. And Vista Thompson.
I am here.
Awesome. Glad to hear everybody and see some of you.
Hey, Lynette, Don Fowles here too. I came in a little late.
Welcome. I saw your name pop up.
Okay,
So
good.
Happy New Year.
Yeah, you too.
So the first item on the agenda we want to discuss is the conflict of interest statement. And so we have been doing some research, and based on that we are an advisory committee, all of you are considered public officials. And so we're doing some more researching. We thought we were going to have someone prepared to do a presentation, but they're reviewing the forms that need to be filled out. So next month we will have someone to further discuss that. But I just wanted everyone to be aware that more than likely we'll have to sign conflict of interest forms based on how it's defined in the statute of who we are as an advisory committee. In addition, I want to remind everybody that because we are following open meeting law, that you cannot have sidebar conversations together to discuss any business of the committee. That would be considered a violation of open meeting law. So just be mindful of that. You can meet and talk about Starbucks and the economy, but as far as specific business pertaining to the committee, you cannot have any conversations. Any questions on that? Or Erin, do I need to add anything?
Sounds good to me.
Any questions from anybody on the committee?
Lynette, it looks like Monica Curry has joined now. Monica, am I right? Are you there?
Yes, I'm here. Thank you.
Okay.
Welcome,
Looks like
Monica.
Thank you.
Carrie as well.
Oh yeah, I see Carrie. Welcome,
Yeah.
Carrie.
And I don't see Carly yet. So, okay. Sorry.
Awesome. No problem. I'm going to switch the order briefly. We will save the website update for the last item. I want to briefly talk about the status of the rules. They have been submitted to the director, and he is reviewing them. Fingers crossed. They may be submitted to the SOS or the Secretary of State by close of business. But as soon as they are posted or submitted, we will post them on the website for review. Mary Kay, I don't know if you have anything additional to add to that. I saw that she was on.
What I didn't hear again, what date you thought you were going to submit them to Secretary of State, or did you say?
The hope is if the director is able to review them today, they will get submitted today.
Oh, okay. Sorry. Thank you.
No, that's okay. Mary, did you have anything? Mary Kay.
She's raised her hand. Does she need to
Let's see.
have some assistance technologically?
Okay, can you hear me?
Yes.
Cool.
Yeah, if they don't get submitted today, it pushes everything back by 1 week. So, if it gets submitted today, we can publish on February 5th, and our hearing would be March 8th. If it gets published next week, or is sent over to Secretary of State next week, we'll publish on February 12th, and the hearing would be 3/15. So it's just, it would be a 1 week delay, basically, if we don't get them in today by 5. So, that's up to whether, the urgency felt by the committee, but I just transmitted them over to Evan for his review, and, yeah, it's 52 pages, so it's a little bit beefy to review. So.
Just some light reading, right? Okay, any questions on the rules or the status of the rules from anyone?
So Mary, maybe we can just remind everybody real quickly, once the proposed rule is sent to the Secretary of State's office, maybe you can keep me honest here, it's about 3 weeks before they publish. And then maybe you can just remind everybody what the next steps will be, because we're going to have a hearing and there's going to be an opportunity for public comment. Maybe you could just give the timeline again real fast.
So once we send it over to the Secretary of State, it does take them 3 weeks to publish it in the Arizona Administrative Register. And once it's published in the Administrative Register, then our public comment period would begin. And our public comment period would go for 30 days. So it would go till midnight of the night before the hearing. And then the next day, and in the notice, we also publish the hearing date so that the public knows that the day after the public comment period ends. So, and then the hearing is scheduled from 10 till 2 on the hearing date, and it will be a recorded public hearing. So anyone from the public who has not had the opportunity to submit a public comment in writing could also come to the hearing and submit a public comment. Often what we'll have is people who have submitted comments in writing, specifically attorneys, will come to the hearing. They will also put something on the record. I think so they can finish twice. But anyway, that's just my personal opinion. But so that's the opportunity that people have. After that occurs, depending on the comments are. So we have to respond to the comments if they ask for substantive changes in the rules. So if we decide that there's a huge substantive change in the rulemaking, then we'll have to kind of start the process over again. I don't anticipate that, but you never know. So we did have a listening session before we even started the rulemaking. So the insurers have been exposed, at least to some of the exhibits that attend the rules. So should be familiar with it. It should not be new information to them, but they certainly have a right to comment. Some of the comments we anticipate will also not be germane to the actual rule writing. So when we did the long-term care insurance rule writing, we had a lot of seniors who were commenting on the fact that their insurance premiums had gone up on their long-term care policies, but it wasn't really germane to the actual rule writing. So we really had nothing to do with regard to that. We would only respond to comments that are germane to the actual rules themselves. So,
Mary?
General, I'm sorry.
Well, I was just going to ask, I wanted to make sure I kind of knew the timeline. So from the date of the public hearing, so we'll have 30 days for folks to submit written comments, and then we'll have a public hearing. And then what is the timeline for the department to review the comments and respond to the comments? And when would we have to issue the revised rule if there was a revised rule?
There's no timeline on issuing the rule.
Okay.
And we obviously like to do it as quickly as possible because
of course
the legislature has asked us to to have a final rulemaking in place by April 1st. But it all depends on whether the comments end up driving us towards the substantive changes. So, and the volume of substantive changes. So we'll just have to see.
Yeah.
But any
But
questions?
it's looking like we're going to have the public hearing, even if the rule gets published next or sent to Secretary of State next week rather than today. We would have the public hearing in March.
March 15th.
So,
It will be published in the notice.
right, the date will be there. So, but I just wanted to give everybody kind of a little idea of
The other thing I would like to do, and I know Aaron's on board with this, I also create a readable version that, because when you submit something to the Secretary of State, it has certain formatting requirements, and it's a little more difficult to read. So I also have created a readable version, which is a compressed readable version, which I believe once we send it over to the Secretary of State, I think there's Aaron is considering putting that on the website so that anyone who wants to read a little easier to read version would have that availability.
We will have information on the hearing as well as the readable version on the website. So.
And Lynette, I see Carly now.
I do see her. I saw her pop
Everybody's here.
Hi, Carly. Happy New Year. Mary, did you have anything else to add?
Does anyone have any questions?
I just had a quick question. I'm sorry, and you may have said this and I didn't hear it well, but when you submit it to the rule to the Secretary of State, when is it that it's published for the public to actually see and review?
It takes the Secretary of State 2 weeks. So if we were to send it tomorrow, they would be publishing it on February 5th. If we send it over by January 22nd, which is the following Friday, they would publish it on February 12th.
But Monica, what we're talking about is not waiting for it to be published in the register. We're talking about posting it to our website as soon as we transmitted it to the Secretary of State's office so that the committee and interested parties can see it.
Perfect. Thank you so much for clarifying.
Yeah, thanks.
Any other questions for Mary? Okay, moving right along. We are going to take a look at the website. We are very excited that it's up and live with some foundational information. I'm excited to hear some feedback from the committee. Mary is going to pull it up. I thought we'd kind of walk through it tab by tab. Some of the stuff is under construction or coming soon as we want to flesh out some of and fine tune the information. But if you just kind of bear with me, here's the landing page. Can everyone see that? Yeah, okay. Any comments, feedback for the landing page?
This is Carrie. I thought it was really user-friendly and very simple, and I thought it was well done.
Thank you. We want it to be all of those things, very user-friendly and easy to navigate. Anything else on the landing page before we go to the first or the next tab?
I guess I was hoping to see if anybody thought there should be other categories, big categories of information that we should be including. Some of the content here, I want to say, came right out of the discussion that we had at our last advisory committee meeting, because there was some feedback about including information about Jake's Law and about the committee itself. So I don't know that we would have put either of those on there. So I wanted to tell you that your feedback is really important to us. So if there's any other, and you don't have to, if you don't have any ideas today, please bring them to subsequent meetings. We're happy to take the feedback anytime, but any other major categories of information that you guys think would be good to include?
Erin, one thing I'm just wondering, when you talk about the difference between appeals and complaints and the documentation needed, will that also give a link or show them basically here's how you file that?
I think we're going to get there, Kathy.
Yes.
We're going to go to that tab and we'll show you. Yeah, you bet. Thank you.
Hi, Carrie again. Oh, sorry. I just make one comment. The only thing that wasn't on there that I thought we talked about that maybe it's just one link is resources if you do have needs around mental health. And so that was the one thing that we talked about, but thought maybe a decision was made to not include it, but maybe a good conversation to have. I think it would be helpful from my perspective.
We are definitely talking about resources. And so another partner in this is ADHS. They planned on being on the call today. However, they have a small plant. They're making a vaccine rollout that they're dealing with. So working with them, because some of those resources are on their website, and we're just need to work to figure out how to link those links from our page to their page to have those listed resources. But that is definitely in the list.
You know, one potential consideration is just key documents like the mental health parity law itself.
Okay.
Just having a place to keep those so people could go to them for easy reference.
This is Carly. One of the things that I was thinking was, something kind of on that first page that tells a, patient or family member whether or not the DIFI is able to assist with questions about parity. I guess what I'm saying is, I know that the law is going to require that, a little insignia on the front of the insurance card for Arizona health plans. Like maybe we can say like, okay, if you have this, then, we are able to help with complaints and appeals or whatever. But just some sort of easy way to help kind of on the front end, people understand whether, they need to be reaching out to the Department of Labor or whether you guys are the right place for them.
Okay. Have that noted.
And Carly, I think you'll see some of that content when we get to the appeals and consumer complaints. Some of the kind of things you just highlighted are there. So, but maybe you can let us know if you think they need to be highlighted elsewhere. One of the things we struggled with when we were putting together these buttons was, what are people going to be looking for when they come here? Right. We talked about the healthcare appeals and complaints button. Was that the right thing to call it? Or would people really be coming saying, would they be asking themselves a different question that they don't see on this list? So maybe you guys can help us with that too.
Yeah, and kind of that was sort of my point before, just about how do you file something, and and maybe for Carly, is there somewhere that maybe just a link on questions, or that comparison, if it's DOL or DIFI, or just something, here's a number you can call, or I don't know, because it seemed like I might call up going, well, I don't know what I'm looking for, I just have questions, or I don't know if I'm filing a complaint. Maybe there's something to grab.
So I think one of the things I had mentioned on the last meeting was this sort of like, and this is not the right term, but kind of flow charting people to the right place. I feel my insurance company is not treating my mental health the same way as a physical health problem. Where do I go next? And is it contacting your insurance company and starting a conversation there? Is it contacting the DIFI with concerns that, this may be a parity violation? Is it contacting DOL? Or, is it drilling down into like what the specific possible violation is? Just sort of like helping guide people, because I think, information is wonderful and helpful, but I think sometimes when you're in the middle of a crisis and you just want help, you just want somebody to like hold your hand through the process, just some way to essentially do that, but in an online format. Does that make sense?
Absolutely. And I think just what you're talking about, as well as Kathy, we're trying to develop like a FAQ matrix that kind of says, here's my question. Who do I go to for this? Is this a violation of parity? Is this DIFI? Is this the Department of Labor? So that's one of the ones, like the coming soon. We're trying to flush out all those details so it's in an easy to read matrix. Like, here's the question. Where do I go for that? Does that kind of answer the question? Because there's so many different nuances, and we won't cover everything because there's so many different scenarios that could possibly be. But we want it to be like a matrix to say, here's my question, and this directs me to this area. And I don't know.
Yeah.
Should we pull up the
Yes, appeals and complaints.
Let's go to that tab so we can kind of
that is really what folks seem to be talking about.
And I was just going to add a real quick, maybe an FAQs section. The landing page would be helpful because to Carly's point, I think sometimes we just don't know what exactly we're looking for. And when we scroll through different questions, that kind of helps give us a start to figure out or piece together what we're doing, what information we're needing. And then it's sort of like a visual version of an FAQ. So there's like the actual question and answer FAQ, and then like a visual, how sometimes they have those step by step. If your answer to this question is yes, then go here and so on. So it's like the word version of an FAQ and a visual version of an FAQ, if that makes sense.
Yeah. So what you're saying, I want to make sure I hear you correctly. So on the landing page, just having an FAQ tab, just like the appeals and complaints tab, and then that direct, like the list of questions, and then linking it back to the appropriate place.
Right, exactly.
Got it.
So I'm wondering, would this be resolved by the FAQ? But on the first page, we have myths. Is there a need for key facts and myths? So when you reference myths, you also have to reference key facts. So I don't know if that can be resolved by the questions and answers. Just a question there. But myths also want to counter with facts.
Yeah, so we will have the facts next to the myth there.
Okay.
But if there's a way we can flush it out, so maybe there's a way to do that through the FAQ and the myths and the facts together. So we'll have to, we'll see how that works. But yeah, the facts are listed. The way that we've started to do the myths and facts is like, here's the myth and the fact is next to it. So.
Okay, got it.
Dr. Hannigan and Team DIFI, I love this page. It is very, very helpful. Good job. I really do like it. Thank you.
Well, thank you for that feedback. And we want to continue to, if we need to expand on this in some way, have links for resources. We want to continue to do that so it's very, again, user friendly, and people can find out, hey, this is my problem. Where do I go? And I can just have a simple click and get to the information that I need or form that I need to fill out to move further on.
I would really urge committee members to look at the content here and see if you can think of other questions, other scenarios that people are asking that maybe we're not thinking of. For what kind of problem are you having? Maybe there are other questions that we should add on here. Of course, bearing in mind that what we're talking about predominantly is commercial insurance problems, not not access related issues. But we did try to account for that I'm having a problem with my access plan. Where do I go? You would go to access, but maybe there's other more specific resources, and that's something we can work with the access folks on. If there's some more a more specific link for them, maybe folks coming to this website might not really understand the difference between an access plan and a commercial health plan, and maybe we need to provide kind of different questions for that to help them understand where they need to go. I don't know. So any feedback that you have about those sorts of things would be so valuable.
Erin, I think one area that stands out to me as being something that should be included is in thinking about Jake's actual story and how he was denied additional inpatient care, even though his doctor felt he was not ready to be discharged. So questions surrounding that type of possible violation.
I agree. That was the same thought I had. What do I do if I'm being discharged from the hospital, I think prematurely or something like that? My insurance will not pay for any further days of inpatient or in the hospital.
We can definitely develop a question around that topic.
Mm-hmm.
One of the changes that I would suggest is you have one that says my insurer is not responding to my urgent request for MHPAC services. Since this is going to the general public, can you hear me, Erin?
Mary, is that Mary?
Yeah, it's a little choppy.
Yeah,
Okay.
I take out what you're saying.
If I could ask most of the attendees, if you're not actively speaking, to go ahead and mute your lines. We are getting some feedback that's interfering with the audio from some of our attendees.
Okay, what I was saying is where it says my insurer is not responding to my urgent request for MHSUD services. Since this is going for the general public, they may not understand that mnemonic, and I would just say mental health, substance use disorder services, and just, spell each of those out instead of referring to industry mnemonics. That would be my own suggestion.
I agree. That's a great catch.
Thank you, Mary. And we don't want to bog them down in our alphabet soup that changes so frequently. So, yeah. Any other feedback for this particular page or tab?
Okay, hold on. Oh, dang it. Never mind. It is there. I was thinking, yeah, no, you've got pharmaceuticals in there, so I think that's fine.
And if you forget something later, you can shoot me an email by all means, and we will, we'll still, like I said in the email, this is a living, breathing dynamic. We want it to continue to grow and expand and change. So we're always on top of the most current information. So this is not the end all be all discussion. We're just scratching the surface.
I was looking at the road that says my insurer only paid a small portion of my claim, and it sort of sends them straight to the Department of Insurance. So I think that probably assumes that somebody's contacted their insurer and their insurer isn't being responsive. But I don't think you would want, I get my EOB and the first call is to the Department of Insurance.
I appreciate that, actually. I was going to say something similar is, this whole idea of hand-holding, have you contacted your insurance company or whatever. I was going to kind of open it up to the insurers to provide some kind of recommendation of like how you would walk through that so it goes through, the proper steps. I mean, because obviously we're not wanting to burden the department with a bunch of calls that could have easily been resolved on the front end. We're really hoping to only escalate where there are true issues that need to be mediated or what have you. So yes, I was actually just going to bring that up.
And I think sort of the notion of a decision tree that Monica talked about earlier would help us get to that. I tried my insurance company and I'm getting the runaround or whatever the problem is. What's your next step?
So providing more of a ladder type of thing, escalating up through the proper chain of command, basically.
Right.
Not just going straight to the department. Okay.
Yeah, what steps can I take? And I know it drives everybody crazy when you tried to work on the website, not your website, but any website, and they're sitting there telling you, while you're on hold, you can look in our website. So self-help only goes so far, but
absolutely
some steps to take before you push the panic button. And sometimes the panic button is appropriate.
And maybe for consideration, like on this page, that question is a link to like the next question. Did you contact your insurer? Here are some helpful tips for, like the things you might say about this problem to your insurer. Because I think also a lot of times we're not very well versed as a patient about, our confusion or our frustration or what the issue is. And so, maybe like a little bit of like, here's how you might broach this conversation with your insurance company. And, maybe the next thing is, well, I've already talked to them. And so now it takes you to file a complaint or whatever.
Absolutely.
That's good. Thank you for that.
So
this is Carrie,
this is John.
And I'm wondering this.
Go ahead, Carrie.
Thank you. I'm sorry, I couldn't figure out how to raise my hand on here. But this may be getting too much into the weeds, but when I think of really complex situations and where I end up providing a lot of technical assistance for families, a lot of times it has to do when they have secondary insureds and the coordination of care between the two, and particularly as it relates to inpatient. And I don't know if there's a question on here that may be helpful to that, or if that's just too far outside the scope. But I mentioned that as something that I know I get asked a lot of questions on, and provide a fair amount of navigation as it, kind of, those can become very escalated situations and pretty urgent in nature.
I mean, I don't think it's too far-fetched for us to take a look at it to see how we can, even again, directing the person to the right place if they have secondary insurance, and how to start that process of flushing that out. So yeah, we can definitely look at that. John, you were going to say something?
Yeah, actually, in regard to that, Carrie, it might be helpful if you sent over kind of what you see as the typical problem, right? And what your sort of response might be. That might be really helpful for Lynette to have that information. What I was going to say is going back to the insurer only paid a small portion of my claim, and Lynette, I sent you an email about this. That actually would not be a complaint. That would be an appeal to the insurance company, because that's a coverage decision. Whether or not an insurance company pays a claim is a coverage decision. So
sorry, John, I gotta qualify what you're saying there. If the insurance company denies the claim outright, it's an appeal. If the insurance company has paid a portion of the claim, it's not an appeal. But to the point, other folks' point about, and I'm sorry to cut you off there. That was really rude. I apologize.
No,
I just want to make a distinction.
I think that may require some research then. My previous experience would call that actually a reconsideration. It's like the next step of an appeal. So I would encourage us to relook at that.
Okay.
This is just a weigh in on that point. I know exactly what you're talking about, Erin, and I think it, gets to one of the basic problems, which is the overlay of state and federal law. Because under, state law, we have this, what is an appeal for us, which is denial of the, authorization for a service or payment of a claim. under federal law, it's such a broader term. It's the adverse benefit determination, which does include, denial of cost share, and you can fight about the money. So the semantics, and that's one reason why everybody struggles with this. And I think particularly, patients and members, it is just such a difficult, complex area of the law. You don't know the right words to use.
Which Vista, I got to say, this is kind of funny that we're having this disagreement, because it points out if we're having this disagreement, then certainly the consumers are going to have a misunderstanding.
Absolutely.
And your point about, Aaron, this may be the distinction. Much of my experience is related to federal law, not state law, and so that may be the distinction that I'm confusing.
Well, we
Vista,
really need to clarify things on the website.
Yeah, Vista, you bring up a good point, which we also had a discussion about in the creation of the page, is having a vocabulary tab, because sometimes as a patient, it might be an appeal, but we're saying complaint, and vice versa. And so having a general tab page of just medical and insurance, some of the basic, like the one-on-one of vocab. So when they're communicating to their insurer, they know what words to use, because obviously they say complaint, they're going to get pushed to the wrong department when it's really an appeal. And so definitely, I think that is going to be important to have something like that, just so they know what they're talking about and how to communicate.
Dr. Hannigan, I also think that would probably be helpful, because as a consumer, I might say, yeah, I'm calling to complain. I just am frustrated and I want to complain because this doesn't feel right, and I don't know why it doesn't feel right, but it doesn't feel right. Mm-hmm. So I think maybe setting a baseline for what that means would probably be helpful, because let's face it, not everybody, most people just don't understand the world of insurance at all. And I think that is illustrated by the fact that we've got experts on the phone who are having disagreements that are technical in nature, but
And I'm getting feedback in the chat saying, yes, vocab, yes. So I see you guys. Thank you.
I totally agree with you, because an appeal is different from a customer complaint. So we really just have to kind of put some definitions on this, because they have different resolutions.
Yeah.
So we attempted to put some, can you scroll up a little bit? Whoever's running the website there, the screen, is that Mary or you on that?
It's Mary.
We attempted to put some clarity around when something is an appeal versus when something is a complaint there, but we tried to keep it very succinct. But if you have specific feedback about what we included there, please let us know. Because we recognize that the public is very likely just going to, a complaint is a complaint is a complaint. They're not going to distinguish when something should be an appeal. So this is exactly what we were trying to highlight for them, is when something would be a complaint and how to submit that versus when something would be an appeal and how to submit that. So,
It's also important to remember, I totally agree with the vocabulary issue, and I really appreciate that you guys put that information at the top. But it's also important to remember that the insurance company, if they get a complaint and it's actually an appeal, have an obligation to identify it as an appeal.
Exactly, and also an obligation to define whether it's a quality of care issue. So they go into different pathways.
Right.
I mean, I think that the defining of the appeal is sufficient. That seems helpful. I'm not sure that complaint in that little section is fleshed out quite enough. However, it also kind of led me to another question, which is, you have kind of reached the end of the appeal process and you're unsatisfied. Where do you go?
Okay. So would it be helpful in this area where this paragraph is to maybe bullet point out appeal, and then give the definition of appeal, and then bullet point complaint and give definition of complaint. Would that make it easier to understand, do you think? Just kind of the separation of the two.
I mean, not
I mean,
necessarily, but I think like where it says other health insurance problems should be filed as a complaint, and then maybe give some examples of what that might be, or, you know, and including but not limited to blah, blah, blah.
And if you click on the file and appeal link button there, it takes you to our healthcare appeals page, which tells you in detail the process, and it does, well, actually I shouldn't say for sure that it does, but we'll look at whether or not it walks you through once you have reached the third stage of appeal and you, what are the next steps, but that should be on there as well. If it's not, we'll make sure it's on there. Because you can actually take it all the way to court.
And someone in the chat also said, giving examples of a complaint would be helpful as well. So,
well, that's what we were trying to do with the question. So if we do not succeed, maybe we need to rethink the approach.
Yeah, back to the drawing board on that one. Any other comments on this tab? It's very robust. We have a lot to go back.
Just like I said, I think this is a really great start because it is the way that it's laid out, it's just very approachable.
I just wanted to add, I agree to that. I think this format is really user-friendly, and like the way that the questions are laid out. So I really like the approach. And for me personally, I do like the idea of bulleting out appeal and complaint, and then maybe just you can add a little intro to say examples of each are below. And because to Erin's point, it was to give examples in the definition part. That's kind of what the whole, the whole chart is about. So I think maybe just directing people to say the examples are below might, I don't know, that might help a little bit.
Okay. All right. Are we good to move to the next tab?
Which is actually the myths tab, which is before this one, I think.
Yeah. So as you can see, it's not as robust. We are definitely planning on expanding it, but this is the start of myths on one side, and I think it was Dr. Wilson about having the fact on the other side, fleshing it out. So we definitely want to continue to build on this. So any initial feedback? Hopefully we can put links in later to direct people to areas as well.
I guess to that point, like even the first one, if I'm a consumer and I come to this and I was like, ugh, this happened to me. So was it a parity violation, or is it just that complex calculation does, not, or in my case, that complex calculation makes it different. And now I've got a $100 copay as opposed to a $30 copay that I pay to my, primary care doctor. So like, what does the person do to determine that? Is there to answer this question, contact your insurance company, phone number on the back of your insurance card and call and ask why, or whatever the next step is, just to get the person the answer so they know whether they have potentially a legitimate concern.
So how I envision it is, okay, we have the myth column, we have the fact column, and then what's next column, where we give what you're asking for. Like, do I call the insurance company? Do I file this paperwork? And here's the link to do that, or here's the phone number to take it to the next step. Is that something that you're talking about, Carly? Anybody else?
I was just going to add on one of the myths that I feel like I heard a little bit was people who thought that parity meant that my coverage should be as robust as like the access or the same as the access coverage. I think there was some confusion about my plan doesn't cover all the stuff access covers. And it's because it's just a different plan. And your point here on the all health insurance must cover mental health services is kind of in that direction. But I think something to be said about your coverage is different. It just depends on what's in your particular policy. But I did remember hearing a lot about confusion around what access covers and what commercial covers.
I think that's a good point, Monica, because it's like anything, your neighbor might have a very robust policy. Could be it's self-funded, could be they just got the premium, the Cadillac, could also be their Medicaid, could be it's Medicare, it might be different. So maybe it just, you might want to just spell out a little bit that all insurance policies don't have to be the same and cover the same things, nor does Medicaid or Medicare, and they can be different.
Excellent feedback. Thank you.
Yeah.
Yeah, that's probably a better way to word it, Kathy, is just mental health parity means every policy has to cover the same thing. And that might be a myth, and then you can spell it out that actually every policy is different and you have to look at what your policy is covering.
Right.
And then maybe like, again, holding my hand through all of this as a patient or, the loved one of a patient. Okay, fine. I get that. What does this mean for my policy or, umbrella of policies, and then link to, I'm a group health plan and, as a result, yes, it is required, or I have a whatever the case is, but just carry me to the next step so I know the universe that I'm living in.
Right. And I can see this going back to the previous question about if I have secondary insurance, how does this play out if I have a secondary plan? And how do they, I don't know if we get into the weeds, do they collide against each other? Do they work against each other? How does this play a part if, I do have an access plan and a Medicare plan, things like that. So yeah, that needs to be fleshed out a little bit more.
Yeah, I see customers also struggling with terms of covered services versus benefits versus medical necessity. So I'm wondering, as we develop the glossary, is it valuable to have those definitions?
I think so. Even covered versus contracted.
Correct.
Yeah, it sort of goes to what we were talking about earlier. I was just looking at these questions and wondering if it reads a little bit academically, like, for example, in question number 2, turning it more into kind of an FAQ, my health insurance company doesn't even pay for me to stay at won't pay for my family member to go to a residential, not RTC, but, to get this service. I thought all, policies had to cover this. And then the answer is, well, no, they don't all have to cover this. There's some plans that don't. So phrasing it more to the extent we can use, I think, member experiences that are personal, that are, experiential words, rather than provide coverage for, maybe that'll help a little bit.
Yeah, and I think that's a good point, Vista, and it's back to the point that Monica had, and I was trying to get at too, is that parity doesn't mean parity between other insurance policies, other coverages. It's parity within your own policy, and that I think is one of what's commonly misunderstood.
And maybe that's one of the myth areas we utilize is parity means parity across all plans, and then the fact is it means parity within your plan with who you're with. And so even starting at that level, because like you said, people think it's, I have Blue Cross and someone else has Cigna, and it should be equal between the parity should be between the two, and it's not. It doesn't work that way.
Yeah, or even a question like, I have Medicare. Does parity apply to me? Does mental health parity apply to me?
And just a quick comment back to, I think, something Vista was saying. It might be helpful, and maybe you did this already, but to have somebody review the language for reading level. A lot of times we try to put things at a certain grade level, and so it might be helpful to have somebody who's certified in that to do a review of the content here and put it at a certain reading level.
Okay, thank you.
Yeah, we struggle with that all the time when we're trying to communicate in writing, and the insurers do too, of course, when you're trying to balance being technically accurate with fundamentally understandable. So
Even looking at the step therapy one, I mean, if you said my insurance company is making me try, my doctor has recommended a drug and my insurance company is making me try 3 other drugs before I can have, just what people.
Good example.
Through. Yeah.
Great.
Yeah. You may want to add, generic versus brand, whether the patient is taking a biosimilar. There's just so much vocabulary now thrown at patient.
I think Carly cited a resource that we will definitely look at. Thank you for that, Carly.
Access, just a quick question. Access requires 5th grade reading level?
I believe it was 4th grade.
4th grade? I know I used to have to translate diagnosis into 5th grade or 4th grade levels, and it was really difficult, and it become really language that a consumer couldn't comprehend because it was so watered down. So maybe, that's something to think about.
Okay. And Jasmine had a comment about for accessibility needs, so we will definitely look at that as well. Thank you, Jasmine. Anything else for myths and facts? This kind of overlaps into making sure we have vocabulary tab and an FAQ page.
Just wanted to point out that we are giving anybody the opportunity to submit a question that we might want to include here. I'm not sure if that's on our appeals page, but certainly anybody can send questions that they think we should consider adding to that email address at the bottom.
Okay. Can we go to the next tab? So we felt it was important to highlight Jake's Law and all the work behind it to get us to where we are now, right? This is how our committee is to be. And so we highlighted some of the issues with Jake's Law, the importance of it, how important it is to Governor Ducey's office, that we look at the parity and make sure people are getting the services that they need. And so I know, Carly, you were mentioning earlier about the discharge and how that was an issue. And we can definitely tie that in here as well. But we just wanted to make sure we had cited this as Jake's Law, know how it came to be, how we arrived, and how it ties in with the mental health parity.
One thing on the Children's Behavioral Fund, I believe those are though for services when they're referred by a school. And you might want to put that in there.
Okay.
I agree with that, Kathy. And I think Access might have a web page on that program that you might want to link to.
to the point of linking things, I mean, easy enough since you've already created it, but you know, in here it says that it established the advisory committee. Might as well put a link to that page from there.
Any other comments for Jake's Law tab? Marie, can you scroll down? I don't know if there's anything under the picture.
Was there any, is there any page on DHS's website about the suicide mortality review team or any of the data kind of dashboards that were potentially going to be created as a result of that?
So in speaking with the representative from DHS, I don't believe there's anything up yet. They are working on that. And so the plan is for them to be at the next meeting to kind of have a report and some stuff for us to review. And getting ahead of myself a little bit, but since you brought it up, to talk about some of the other issues that we discussed at the previous meeting, like discharge planning, case management, some of that falls under the realm of DHS. We want to have their input here and be able to talk about it because they're the ones that will be able to have more decision-making power through their department to make those changes for that area, for those areas. So,
yeah. To that point, the one about the follow-up services for patients who visit a hospital at risk for suicide, which kind of gets into the whole, they are doing new discharge rules. You know, if they have their first draft out. I don't think you're going to get here. We're going to show links to drafts and stuff, but it might be just kind of a heads up. You might be at some point want to link to those rules when they're finalized.
Absolutely. Any other feedback for this tab? Alrighty. And then this is about all of us here. It's about the advisory committee, our purpose, what we directly from the statute, and then all of us that are part of the committee. And then if you notice at the bottom, it will have a link for our past agendas, current agendas, and the link to the meetings. Our meetings tend to be large, so it'll link it to the YouTube page that we have. So you can see the meetings because we do record our meetings.
Guys, I really wish I could stay on for the last part of this, but I have a meeting I need to get to. Is there anything else I can help with before I hop off?
Thank you for joining us. If you think of anything else, just shoot us an email. But thank you for your time.
Thank you.
Any comments on this tab? No. All right.
I had a quick question about the actual advisory committee. I don't remember if it said how many people or anything like that, but I just noticed that we don't have any actual self-advocates or consumers. So I was just wondering about that. We have like it said 4 family members. So I don't know if there's at some point an opportunity to include like a self-advocate. Might be something to think about.
Okay.
Monica, this is, I guess I need help understanding what a self-advocate would be versus a family member or I'm trying to think of the other one we've got, because we have other kinds of like the Arizona Psychiatric Society, what would a psychiatric?
The actual individual consumer.
Oh, a patient.
The patient that went through the experience for themselves, as opposed to a mom or dad or a loved one. So that was my only.
Some of the family members also are identified as self-advocates or survivors. We just didn't put that on the page.
I think
the law allows it to be either.
Yeah, it's clear the statute says specifically kind of what the composition is, so you can't just batting in, but it might help if you're naming a type, what's the type of the statute calls for, and maybe that explains a little more. I mean, you know, it says family, what is it, whatever it says in the statute, and then perhaps you further say, or you know, they're a consumer. I don't know, so maybe they understand why. Because obviously the statute doesn't say Blue Cross. I mean, just to pick on Vista there, but maybe it's Health Blue Cross, you know, something like that.
Okay.
Yeah, so maybe we can add a column to that just indicates what category of member they are based on what the statute, the specific categories in the statute.
We can do that. Anything else on that page? Tab. Okay. We made it through. Any other final comments before we move to the next agenda item on the webpage? We have a lot to go back and I thank you guys for your feedback. It is very robust. Lots of great ideas. No. We don't have a need at this time for an executive session. So moving on to the next meeting is February 26th. Okay for everybody. Or not okay. Hopefully we'll have a more extensive discussion on the rules at that time and there'll be some movement on that. Is that so? Yes, no?
Yes.
All right.
Good.
Yes.
Perfect. And then, as I said, Carly had mentioned something about DHS. And so I just, for next topics, for next agenda, we really want to start digging into, we'll definitely look at the website again. We'll definitely, you know, the website and the rules will more than likely be standing items on our agenda because they're ever evolving. But definitely want to have a rep on for next meeting to talk about more about the conflict of interest statements, as well as I know there was a big discussion about discharge planning and case management that we definitely want to start digging into. And so the plan is to have in the suicide mortality review team, definitely to have those topics on the next agenda with a representative from DHS. Anything else for next agenda that is pressing for anyone?
I don't know that it's pressing, but it might be worth discussing the federal legislation that just was enacted at the end of this last year that has some provisions related to mental health parity in the Consolidated Appropriations Act.
Vista, was there something, just were you thinking maybe just an overview of it and an opportunity for Q&A, or was there some particular focus on it that you were envisioning?
No, nothing in particular, just the fact that it exists, it's out there, and it's, you know, one more overlay of law.
Okay.
Any topics for next meeting? Any last questions before we adjourn?
I was just thinking about some homework. I mean, I think I will try to go back to sort of my business folks and say, what do they think would be helpful? You know, what are common questions that we sometimes get related to mental health parity that would help us frame some of the, you know, the Q&A or the myths and dispelling the myths. And that if others could do that as well, I think that would help us flesh out the, you know, the content.
Thank you, Vista. I like that. Yeah, if anybody in their prospective disciplines and industries.
Yeah, that's a good idea.
have-
I think from the provider's
Give-
perspective too, I might want to ask them, because it's not
Yep.
just consumers who sometimes have to.
Right. And so asking questions so we can flesh out. There was a lot of feedback in the chat about different vocabulary. I love that, because we all want to speak the same language, and when you start dealing with a lot of alphabet soup, it's, you know, everyone's language is different.
Right. There's a tremendous amount of information, but I think, Erin, doesn't the NAIC, their consumer communications, they have a subcommittee? Haven't they produced a fair amount of that kind of content that might be a good starting point?
Specifically on mental health parity?
No, not on mental health parity, but just, I mean, I think we were talking about some just basic insurance terms that would be.
Oh, yeah, I think they may have a glossary, and they may have, you know, using your insurance ID card document.
Yeah, they have Insure You, or they used to have Insure You. Yeah,
What was that, Mary?
they used to have Insure You on their website.
I can't hear you, Mary. Sorry.
I'll put it in the chat.
Okay.
Thank you, Mary. And just to clarify, Director Jamie Snyder from Access was on. She had to hop off though, but she'll be sending some feedback. She heard some of the discussion around stuff, so she'll be giving us some feedback, as Access is an advisor to the committee as well. So I will share that feedback with the committee at the next meeting once I receive that. Anything else before we adjourn? Okay. I thank everybody for their time. Make sure everyone, you stay safe, stay healthy, be vigilant. We have a lot going on right now, so wanted to see everybody at the next meeting. If you have any questions between now and then, shoot me an email, and we will see everybody next month.
Thank you.
Thank you.
Thank you.
Thank you, everybody.
Have a great weekend. Thank you.